Okay, let's see if I can get this right. I am on Facebook Live. I'm waiting for somebody to join in. Otherwise, I will be doing what I usually do, which is videotaping. Is anybody on yet? Hi, that's somebody. I don't know who it is. Hi, John May. I'm going to wave at you. Hi, John. Okay, so let's go. I'm going to start today. Hi, it's Dr. Sharon with hi, Jeffrey Watson. I'm going to do a quick Facebook Live tonight. I always say it's going to be quick. Please ask your questions. Today, I am going to focus on, is it the cold or flu? That's part of my personal testimony because this week was a cold week for me. And going to talk about whether, hi Michelle, whether you should exercise when you have the cold or flu, etc., etc. But also going to talk about sleep. So hi, hope you guys will join me. Hi, Jeffrey Watson. I am waving at you as well. A little bit of housekeeping. Pastor Paul Rooks, are you in Maryland? Just shout out and say yes, Maryland or not. Do want to make a one of the hats that I wear has executive director of the Koshar Foundation, and tomorrow we are co-hosting an event in Maryland, wherein we are bringing in faith leaders as a faith leaders luncheon. Please inbox me because we will actually also be with some potential funders for some of your events at your churches. And certainly if you are in the health ministry of your church, please, please, please inbox me. We have a few spots that have opened up that we will be able to bring you in. The event will be held at Copper Canyon restaurant, nice meal and all that, but more importantly, really linking and bringing together some faith leaders. Now, I'm going to go, hi, Terry Spicer. What's up? I'm so proud of you and what you're doing in North Carolina with your foundation. So let's get started. Number one, it is Terry Spicer just came on, and her foundation is doing a tremendous work with breast cancer and providing services for folk with breast cancer in the state. Terry, please put your link up. Again, I am so very, very proud of you and all that you are doing. And this is, we're coming down to the end of Breast Cancer Awareness Month, but guess what? Awareness may be once a year, once October, for both that and domestic violence. But these are issues that plague communities around this country and individuals every single day. So we need to make sure that we keep awareness up. Sissy.org, I love the name, Sissy.org, which provides transportation for persons and support services for persons with breast cancer. We don't think about it, but hey, if a woman is going through or a man is going through breast cancer challenges or any challenges, you got to get to the doctor. You need support services for your family. You may need gas. You may need any of those things, and sissy.org and it's thesissy.org. Please, please, please check out that website. I'm a North Carolina girl. And I really, really do support Terry Spicer and the great work that she is doing. She does a fabulous event every year. And please go to that website. Do support her. And guess what? It is only, maybe you have $10 to donate to help a woman to get back and forth to the doctor, to radiation, to chemo, but do something. And again, this is October's Breast Cancer Awareness Month. Today at my home church, it was Pink Sunday with the health ministry. Shout out to Ebenezer AME Church, but we are always doing something around breast cancer, domestic violence, and really is one of the more progressive churches in the nation around making an impact. I visited Mount Enon Church today, and today, unbeknownst to me, it was Domestic Violence Sunday, and it was so much purple. And really, if our community organizations, our churches, don't really become involved, it becomes a national campaign that doesn't penetrate to the community. Again, if you are a pastor, particularly, or a faith leader, or a head of health ministry, inbox me if you're in Maryland, because on tomorrow, the Koshar Foundation, which literally has tens of thousands of churches in our network around the nation, but we are hosting an event, co-hosting an event wherein we're bringing faith leaders around the table to talk about health advocacy and that stuff, but also to introduce them to persons that will be able to help them, not just with some words, but with hopefully some funding and that stuff. So do inbox me. There are a few slots left. Now, we're going to get to it. Number one, I've gotten a lot of questions over the last 2 weeks. And hi, Pastor Karen Jackson. I know that your church will be available and around tomorrow at the Faith Leaders Luncheon. Thank you for that. But it really is important for us to connect. Somebody just type connect. Okay, so I actually this week have been extremely busy, been traveling, and was knocked out with the cold, but still had to travel. I don't have the luxury of being able to take off a lot of times. So I was on a train on Sunday at a great event that I talked about and that I emceed, but then got a cold on the train because people nasty and don't use hand sanitizer and cough and all that and stuff. And the cold is a viral illness that is transmitted via air, via spittle and all of that, and had to get back on the train on Wednesday to go back to New York. So I was huffing, puffing, taking medication, over-the-counter stuff, looked at some antibiotics. I'll be very transparent. Looked at some antibiotics and was like, do I need to try to knock it out with some antibiotics? Well, guess what? A cold is a virus, so antibiotics don't work. I didn't take the antibiotics, but I looked at them hard when I was feeling very bad. So what's the difference? I got little notes because I want to make sure y'all know, and I will put this up. I talk about this all the time, but cold and flu. Do I have a cold or do I have a flu? Okay, number one, when did the symptoms come? If all of a sudden you have horrible, you feel like you were run over by a Mack truck, all right, that is the flu. The flu is abrupt. All of a sudden you feel bad, okay? Now, cold is more gradual. I start feeling a little achy, feel a little something. Okay, now, fever. Usually with the flu, you have a fever. With the, with a cold, generally you don't have a fever. Other things, aches. Feel like you were hit with a Mack truck. That is the flu. So you're achy, you just feel horrible. Cold, you have some aches, but not bad. Not sure of what's up. Your sound is off. Can y'all hear me? Everybody else can hear me? I hope so. Okay. Maggie, your sound is off. I hope you can hear me. Okay. Chills. Common with the flu. Uncommon with the cold. Feeling very tired, weak, and all of that. Hi, William Powell. Feeling very weak, all of that. Again, you feel like you were hit with a Mack truck. That is generally, and fatigue, that is generally the flu. Sometimes you get that with the cold, okay? Sneezing, very common with the cold. I was sneezing, blowing my nose. It was disgusting. I hate blowing nose. Even when I was seeing patients, if you were one of my patients, residency, whatever, if you blew your nose, I'd be like, wait 1 second. I'll be back because I can't stand to hear anybody blow their nose. Little known fact. But I was blowing my nose. I was disgusted with myself. Okay. And feeling cool, warm. I'm feeling warm right now. Sneezing, stuffy nose, very common with the cold, unusual with the flu. Sore throat, sometimes you get that with the flu, but more than likely, if you get a sore throat, that is a cold. Chest discomfort, that is very common with the flu, and mild to moderate, sometimes chest discomfort and cough with the cold. Headache is very rare with the cold, but very common with the flu. Y'all got that? Did we get that? Hi, Melinda. Hi, LaShawn. So I'm going to go through it again quick. This is flu. Comes on fast. Usually you have a fever. Usually you have aches. Chills are common. You are very tired, feeling weak, sneezing sometimes, stuffy nose a little bit. Cough, common with the flu. Headache, common with the flu. Cough. Now, cough is interesting because you can have it in both, but it is more severe with the cold. Okay? So now, cold. Symptoms are gradual. Fever is very rare. Aches, very slight. Chills, not common. You feel tired sometimes. Sneezing. Yes. Now, let's go back to feeling tired. I felt tired. I need to turn down this heat in this house because I turned it up because I was cold. I felt tired with the cold only because I wasn't sleeping because I was blowing my nose and coughing. I'm going to be right back. Y'all can hear me, but I'm opening this door because it's hot up in here. Okay. Yay, I'm back. It's hot. Okay, so now, but just by having the flu, you can feel like I'm very tired. I talked about sneezing, stuffy nose. Woo, that was my issue. That was my issue this week. To the point, hi Marie Campbell, to the point that you dry yourself out with all the antihistamines. Key point. If you have high blood pressure, which I do not, but I actually end up taking Coracetin and HBP because I don't want to have high blood pressure, right? And I don't want my blood pressure to spike. You cannot take all of these medications for cold and flu for long periods of time. You just should not do it because your blood pressure will go up. And I do recommend that you take Coracetin and HBP, even has a way to make sure that your blood pressure is not high. But certainly if you have hypertension or are taking medication for hypertension, use Coracetin and HBP, cold and flu, instead of the other things. And don't use any of the items more than 3 or 4 days, okay? So we talked about cough with cold. It's very usual. And headache is rare with a cold. It was a bad time for me this week. I was taking stuff, all these sinus things. I'm sweating even now because I turned up the heat in my house and didn't turn it down. That's cold versus flu. Guess what? The flu is a virus, as is the cold. Do antibiotics, yes or no, work on viruses? No. So, unless you have bronchitis or something like that, you don't need to call and ask the doctor for a Z-Pack, okay? Because it doesn't work. Now, cold flu, make sure you get your flu vaccine, which I've talked about a lot. It's really, really, really important, okay? All right. That's it. Do y'all have any questions on the cold and flu? I'm looking at your questions and trying to stay cool in this house myself. All right. So now, one of the questions that we got this week, a lot of the questions that we get. And then I was talking to one of my friends on my way home about sleep. This is key. The bedroom is for 2 things: sleep and sex. I told y'all that. When you walk in your bedroom, typically, your brain should be cued to you needing to wind down and go to sleep. So with sleep disturbances, hi Earl Hines, if you have the TV on, music on, or do like I do and work a lot in the bedroom, that's not good. That's not good sleep hygiene. And one of my friends that I was talking to, his shall remain nameless unless he comes on. Yes, CPAP is a nightmare. CPAP is continued pressure, airway pressure for persons with sleep apnea. And it is a machine that you sleep with. It does disrupt your sleep. So yes, Terry Spicer, it is a nightmare. But by using the CPAP machine, actually, you get better sleep because you're basically, it helps you keep pressure up. And as well as, I'm trying to read my stuff, it helps you keep pressure up so that you can pressure up, as in your airway pressure, so that you are not snoring as much and that you are not having as rough a time with sleeping. If you have sleep apnea, you literally have breaks in your breathing. That's a whole nother Facebook topic. So keep the CPAP up, but the noise from the CPAP can be disruptive. So now, bedroom for sleep and sex. It should be a place that's not so cluttered. It should be a place that you typically, and I'm the biggest hypocrite because I have a huge TV screen in my bedroom, but that you are not supposed to watch TV and those things, because when you literally walk into the bedroom, you are supposed to know, hey, I am supposed to be winding down, I am supposed to go to sleep, or I'm supposed to have sex. S and S. That's what's supposed to happen in the bedroom, okay? And so if you are disruptive, and again, one of my friends that I was talking to used to do morning TV. And so he is accustomed to waking up early. And so his sleep pattern is totally jacked up. You typically are not supposed to have to set an alarm. Do you know that? I wake up now, and I was telling him I wake up at about 3:55, 3:59 every day, because for the last couple of months, I've always slept. I'm an early riser, and I go to bed late, but that's a horrible sleep pattern too. But you aren't supposed to need a alarm, because your body is supposed to go to sleep at around the same time and wake up around the same time. Now, one question from Patrice Myrick. My question is, why do you get less sleep as you get older? I can't sleep past 5 or 6 hours. Yes, that is true. Your body's need for sleep changes. And guess what? If you're not tired, you're not going to want to sleep. And particularly as we get older, our sleep cycles change. It's a natural progression. Your sleep cycle changes a bit. If you are not exercising, if you nap during the day, well, your body says, well, I'm not really tired. I do apologize. It's hot up in here. I'm not tired, so I'm not going to go to sleep. But you should wake up, even on the weekend, you should wake up and go to sleep at about the same time a day. The other thing, when you have problems sleeping, and this is what we were talking about, I was talking about with my friend today. He was waking up and couldn't get to sleep and really just laid in bed. No, what you should do is get up, walk out of the bedroom, go do something else in some other part of the house, and then come back and try to go to sleep. Don't force that counting sleep, sheep, and all that other stuff. That doesn't really work. And turn off the TV. What he did was actually turn the TV on. Well, think about it. If you're trying to wind down and go to sleep, why would you turn on the TV? Right? The other thing is, good sleep hygiene says stop taking and drinking caffeine before you go to sleep. Usually 4 to 5 hours. And remember, chocolate has caffeine in it. Sodas have caffeine in it. I know nobody on here is drinking sodas. Tea has caffeine in it unless it's decaffeinated. So do other things. So decrease your caffeine. Exercise is wonderful for sleep. Not exercising at night, because actually you should not, if you're having sleep difficulties, you should not exercise at night, because exercise starts endorphins and pumps you up. And so you're going to have a more difficult time falling asleep. But if you are exercising, if you are making sure that you are busy, you're tired, so you'll sleep, okay? But if you come home after work and take a 2-hour nap and then want to go eat dinner, and then all of a sudden you want to go to sleep at 10 o'clock. That's not going to work. Why? Because you're not tired, because you took a nap. And it starts a whole cycle. So how many hours of sleep should you get a night? That depends on your body, but typically 5 to 7. If you have worked at night before, and you have your sleep patterns are off, you have to retrain your body. So this means that you would literally start to say, okay, at 10 o'clock at night, I'm going to sleep. I am going to work out in the morning. I'm going to stop my caffeine. I'm going to really try to go to sleep at around the same time. And I'm going to wake up at 6 o'clock, and I'm going to, if you have to set an alarm, whatever, then I'm going to try to wake up at about 6 o'clock, or even on the weekend. So we try to make up for lost sleep. That is a misnomer. It's impossible to do that. You just get groggy. And then you can't like sleep late on Saturday and Sunday and then wake back up on Monday and start this process again. Your brain will kick in and say, as I was giving my own example, I've kind of reset my own sleep pattern, and that at about 3:59, 3:55, 4 o'clock, I wake up. Unless something has gone on and I'm extremely tired, then I'll wake up at 5 or 4 or 4:30 or whatever, and then I'll force myself, if I've decided, well, I am going to take some extra time because I need a little extra time. And then how many of you will sleep a long time and wake up with a headache? Because if I would sleep to 9 o'clock, I will have a massive headache because that's not my normal pattern. So quickly, 1, sleep, sex, that's all supposed to go on in the bedroom. All right. If you really are having sleep issues, do turn off the TV. And because your brain, if you hear the TV, your brain is listening to the TV. It's not even conscious. Your brain, and people say, well, I can't fall asleep without some noise in the room. You actually will have to go through the process of retraining your body, because your brain is listening to CNN, MSNBC, whatever horror thing is on TV. A part of your brain is listening, and your brain needs to shut down. If you are very stressed, it is very difficult to sleep because your brain is trying to figure out what is going on, right? And the worst thing you can do if you're having trouble sleeping, people say, I'm going to have a hot toddy. Actually, drinking alcohol is counter to good sleep, good sound sleep. So you will have a superficial sleep, but you won't go into a deep sleep. So don't start, hi Cherise, hi Sora, don't start sleeping, right? Trying to make sure you have a glass of wine or whatever. Yes, it will relax you, but your sleep quality will be off. Does that make sense to you all? Your sleep quality will be off. The other thing is, some people say, well, I'm going to have a nice hot cocoa before I go to sleep. Now that it's getting colder. That's got caffeine in it. That may, again, disrupt your sleep. So you set up your environment, a non-cluttered environment. So the bedroom can't have all your clothes all over the place. Non-cluttered environment. Dark. Yes, you need to sleep in dark. And no TV, no extraneous music or those things. If you do have the TV on, then set the timer so that it goes off at a certain time. You may want to take a warm shower or bath. I love a bath before you go to sleep. And that will actually help calm you and get you ready for sleep. Your cell phone, them 10 emails that you're going to get, Facebook going to still be there in the morning at 6 o'clock. It's still going to be there when you wake up. And even texting, and my friend that I talked to today, I was like, if I text you no matter what, you will answer a text. Why are you waking up to answer a text? Jesus ain't coming and you got to tell the world that it's not that important. Now, if you have elderly parents or people that depend on you and you need to have your phone on, that's another issue. But generally, you really need to make sure that you wind down, because your brain is made such that it's just listening and waiting for something to pop off. And that means you never go into deep sleep, which is REM. You got it. Patrice, I love that. Hot bath with lavender helps me. A hot bath helps me. But then, we're not supposed to have hot showers or really hot baths because it dries out the skin, but whatever. I will take a hot bubble bath. That's a luxury. Okay? So that's sleep. The sleep-wake cycle, again, train your body. Turn the lights out. When you walk into your bedroom, especially if you're not sleeping 4 to 7 hours a night, we got some issues. And actually 4 is really pushing it because you need sleep. If you don't have good sleep, it's been linked to, number 1, obesity. Okay. Number 2, heart disease. Number 3, stress and irritability. 4, dementia and memory loss. All of those have been linked to inadequate sleep. So this is not just you're going to feel tired. This is your health is related to sleep issues. Y'all got that? So I got the cold and flu questions all week. And what do I recommend? When you are, I'm going to go back to this. When you are treating the cold and the flu, because I was really pushing it because I really had to do stuff. Make sure that you follow the directions. You don't need to take whatever the brand of cold and flu stuff for more than 3 to 4 days. Now, prevention. Prevention is key. Hand sanitizers, cover your mouth. And then when you notice one of your crazy coworkers is coming to work with the flu, that's the worst thing you can do because you are going to pass it on. Make sure that you have some disinfectant around. Those kind of things. I do recommend echinacea or vitamin C. They may help you. They're not going to hurt you. Yes, Arleta, isn't it Arleta Whitaker? Melatonin for sleep has been shown in some cases to be good. What I say is try it. Try it for about 2 weeks. If it helps you, great. If it doesn't, then you can step away from it. It's not really going to hurt you. Exercise when you have a cold or asthma flare-up. I'm so glad, Sharice, you asked that. So I'll go back to me. This week I had a cold, and I still had to work and push through and still travel. I shut down exercise. I was so happy to be back in the gym yesterday. It was like it was Christmas. But I took 2 to 3 days off of exercise and certainly didn't hit it as hard because I had a cold. My body was saying, fool, sit down, right? And so I really couldn't sit down 100%, but I was like, I can't do a spin class, and I'm coughing, and everything's snotting and all that other foolishness. Plus, I'm going to infect other people. I'm contagious. And so I sat down. I got more sleep, get more fluid. If you need to take Tylenol or something like that, you do that, but take care of you. And make sure, the key point is, please, please, please drink plenty of fluids because you need to stay hydrated. Just like now, I'm sweating a little bit because I turned up the heat. I was having some chills. I turned up the heat. But when you sweat, that's fluids leaving. And the other part is, I notice for myself, you're taking antihistamines, you're taking decongestants and all that. What does that do? Dry up the nasal passages, right? Well, it's not just the nasal passages. Your skin gets drier when you're taking that stuff. So you have to moisturize. If you have a humidifier and those kind of things, you need that around. And dry heat versus wet heat, whatever. It's too deep for me. You're going to get dry. Drink some water. So I'm drinking my green tea, antioxidants and all of that, but drink, whether it's the cold or the flu. Vitamin C, yeah, that will help. Echinacea for prevention, or those fluies things. Some of those work, but the best part of prevention is wash your hands. Make sure that you are readily being careful about, again, people sneezing around you. People nasty. This is nasty. People are nasty. Right? So you go in the bathroom and you see people come out and they ain't wash your hands or nothing. Or you see people in the lunchroom coughing and blowing their nose, putting the stuff on the thing. You need disinfectant. Walk around. I have hand sanitizers everywhere. Hand sanitizers. Pray over your food. Do all that. And then just know you do need the flu shot. And after a certain age, you're going to need the pneumonia vaccine. every week, or literally every day, I think I get an update on the flu and where we are in the country. And the flu it's here. So do get, and this is key, because I think, Sharice, you're saying you had a cold last week. If you have a cold, don't go get the flu shot when you have a cold. Wait a week or two. So I was supposed to get my flu shot last week, literally. I can't do it. I'm not going to do it now. I am going to do it next week. Okay? Hi, Kevin Fauntleroy. Hope to see you next week. So cold and flu, we talked about what's a cold, what's a flu. I am going to put up the chart on this Facebook Live. We've talked about, you said F the flu shot. Kevin, your old bud need to take the flu shot unless you're allergic to eggs. I don't know how my friends come on Facebook Live trying to go against what I said. Now, you need the flu shot. The flu shot does not give you the flu. That's some foolishness. It does not happen. And if you get the flu, it doesn't say 100% you will not get the flu. It says that if you do get the flu, the flu shot will help and the flu won't be as bad. Okay? That's that. Are there any more questions I left off? Thank you about the sleep. What is, somebody type in right now what I said sleep is. What did I say sleep is? What the bedroom is for? The 2 S's. Sleep and sex. That's it. You can have sex in other parts other than the bedroom, but it's for sleep and sex, right? And if you cannot get to sleep, get up. You may need to go to another part of the house, whatever. It really is training yourself to be able to sleep and knowing that this is, I am winding down. I need to sleep. And you need to get deep sleep. That's right, Karen Jackson. Sleep and sex. That is what the bedroom is for. And I know it's hard because you want to watch football in your bedroom. I want to work in my bedroom. I want to do whatever in my bedroom. But you really, really, really need to make sure that you kind of get into a deep sleep and get into good sleep patterns. As we get older, they are disruptive. My mother wakes up every 2 or 3 hours. My mother is 78. And so you have shorter increments of sleep, but she also will take a nap in the middle of the day. That is not good sleep hygiene. Okay. There was some question that I just missed. Oh, Lord. Girl, it was a viral thing, and then asthma, prednisone times 2.5. Oh, you're talking about, Cerise. Well, this is key. If you have asthma or COPD or all of that, the cold and flu is going to be a little worse for you. Because, why? Your lungs, your upper respiratory, all of that are compromised already. So you need to just make sure, and especially if you have asthma and that stuff, you really need a flu shot and a pneumonia vaccine. Okay, if you have a pre-existing condition, if you have a pre-existing condition that people are trying not to cover, but anyway, that's a whole nother thing. Pre-existing condition, talk to your doctor about should I get the flu shot or not. I look great in red. This is orange. And I do look better in red. I actually am an AKA, but everybody knows I look better in red than pink and green, but that's all right. It's okay. The mother of them all. It don't matter. Terry's on here. Terry's a Delta. I love them all. We love all our children. So Terry says, I'm a natural insomniac. I don't get deep sleep and my eyes just pop open. My mind is racing. Key point. And this is for all of us type A personalities, Terry. I know you one just like me. You also, if you are worried and you are trying to figure out life's problems and issues, your brain does not shut off. And when your brain does not shut off, you don't get good sleep. And so deep breathing exercises, prayer and meditation, those things before sleep. Someone asked me earlier about melatonin. That may help. But really to kind of wind down before you get into bed. One of my friends said that he got home really late last night from a little whatever, got home really late and then went immediately to bed. Often you have to break the cycle. I've been out, I did whatever, I'm coming home. Maybe I do need to watch TV a little bit, even though it's late, just so I can wind down or listen to some music. Have a glass of water, but be careful because then you'll have to get up and use the bathroom all night. And then I will go into the room and go to sleep. All of these little tricks, your body will kind of tell you this is what you need to do. And as I talked about going to the bathroom, if you're a diabetic, for instance, or you have hypertension and you take a fluid pill, for God's sake, don't take a fluid pill right before you go to bed. Like I forgot my blood pressure medication this morning, and now all of a sudden I'm going to take a fluid pill. Number one, your medications should be taken as your doctor told you to take them, and a fluid pill would be taken in the morning. And so put it next to your toothbrush, as I've told you before. But if you're having to get up every 2 or 3 hours to go to the bathroom, has many diabetics that are not in control, that will disrupt your sleep pattern. But what do? You get up, take care of your business, go back to sleep. Also, sleep in a cool room, by the way. Sleep in a cool room. And then if you're a woman in midlife crisis, going through menopause or whatever, make sure that there are layers. So you need to sleep in some silk, get rid of that stupid flannel, especially if you're married or, with your partner, your man or woman. Ain't nobody want to see no flannel. That's the sidebar. That's the Dr. Sharon sex talk. Throw the flannel out. Sleep butt naked, whatever. And make sure women, hate to tell y'all this is Sunday, but this is health, right? Women, you should never sleep in panties. Y'all got that? Men, tell your women that. Never sleep in panties. I'll do a whole nother Facebook Live with Dr. Octavia Cannon, the OBGYN. Don't sleep in panties, women. Did y'all learn something with that? For real, you shouldn't sleep in panties at all. Everything needs to breathe. Did you know that? It needs to breathe. I'm serious. You should not sleep in panties. And probably make the marriage last longer. I'm just saying. But for real, I don't see any of my OBGYNs on, but ask your OBGYN, they'll tell you don't sleep. Let everything, you get bacterial vaginosis and other things more when you... Kevin, I see all those happy faces. I'm just saying that's the truth. So men, tell your wives or girlfriends or whoever, don't sleep in panties. I mean, this is a health, I'm being serious. It's a health issue. Don't sleep in underwear. Okay. Men, y'all probably don't need to just let it all hang out. So we're talking about sleep. I talked about sleep. Is there anything else I missed? What else y'all want to know about sleep? Fitbit will monitor your sleep. I love it. That's exactly right. My Fitbit, which is the best investment ever, will monitor your sleep and you will see your patterns. It'll even tell you how much you have been awake. Okay? So, I think we talked about caffeine. Hi, Sharita. I'm type A. I have a notepad at the bedside. Okay, Miss Whitaker, throw away the notepad. Don't have the notepad at the bedside. That's not for good sleep. Okay? Make sure I see Sharon, not Dr. Sharon. Oh, Kevin, yeah, you're going to see Sharon this weekend in CCU. I had a question about statins and diabetes. So let me know what the question is, Patrice Myrick, my girl. So statins are blood pressure medications. I mean, not blood pressure, cholesterol medications. Kevin, you're going to have to act right with your crazy self. Let me just say, I have known Kevin Fauntleroy since North Carolina Central University days. He is an alpha. He was one of my big brothers, but he is cuckoo. All right. I love you, though. He's one of the smartest people I know. But hi, Sharita. Statins are medications like Lipitor, that stuff, to lower your cholesterol. Why do we care about cholesterol? Because cholesterol in high levels clogs arteries, right? And yes, your insurance company suggested to your physician that I take them since you're a diabetic. This is key. Great, Patrice. Okay, if you are diabetic, you are automatically at risk for increased heart disease. Diabetes is a disease that affects you from head to toe, right? How do you combat diabetes? Before you take a pill, know that lifestyle modifications is a key to diabetes. Hi, Onyx. is key. So yes, your insurance company and your doctor actually should think about, even if your cholesterol is not extremely high, if you're borderline, if you have diabetes, you're already at increased risk for heart disease. If you have diabetes and hypertension, you're definitely an increased risk. And if you have diabetes, hypertension, and high cholesterol, we need really, really engagement, right? So you may have to take a medication. Let me be clear on medications, because people talk about this all the time. They'll say, well, and I did a radio show last week and someone really went at me and said, I don't want to take blood pressure medication because da-da-da-da-da-da-da. And I said, okay, well, how often are you exercising? They're like, I don't exercise, I don't have time. Okay. Well, how much are you watching your diet? Well, I'm watching a little bit, but yeah, I'm overweight. Okay. So you don't want to take medication, then you want to drop dead. If that's what you want to do, then that's what you want to do. Because you cannot say, I don't want to take medication as my doctor has prescribed and my numbers are off the chain. And I don't want to make the lifestyle changes because I hate medication, but I don't want to make you have to choose. And it's not, even if you take medication, understand that as a diabetic on insulin, don't go eat 2 pieces of cake, tell me I'm going to just take more insulin. It is all modification. Everything needs to be modified. And you don't have to do a lot. 20 minutes of exercise 3 or 4 times a week will lower your risk for heart disease, lower your risk for diabetes. When I do a talk, we're just losing 5 pounds, just 5 pounds, reduces your risk by 18% of diabetes. Okay, so let's do it all together. Kevin, I'm going to talk to you about your statements about Big Pharma when I see you. I'm going to pop you upside your head, because there are some medications that you need to take. But everything, when you talk to your doctor, this is really important. Tell your doctor, I really don't like medications. I tell mine all the time, I hate drugs. I hate medication. But that's why I get up at 4 o'clock in the morning. I'm usually at the gym by 5 or 6. Right? Because I have a family history of high blood pressure and all that other stuff. My blood pressure is low. My cholesterol is extremely low. But that also means that you have to watch it. And if you have to take medication, it does not mean that this is a forever in your life you have to do that. Do the commitment to making my lifestyle changes. And then there are some people that even with lifestyle changes, you are going to have to take medications or should take medications. But what you do is, instead of taking 40 milligrams, you would be able to bring that down to 10 milligrams. There is not one road to everything. There are different roads, and it's all individualized. But say to your doctor, what can I do, or your healthcare provider, to lower my risk for heart disease, lower my risk for stroke, lower my risk for cancer, lower my risk for all of this? What can I do both in my lifestyle, number one? And then stick to it. Stick to it, okay? And 2, Hotel Indigo, Friday between 5. Okay, I'll tell the source. Stick to it. And then just make some changes that you can live with, okay? But get some exercise. Again, if you take blood pressure medication, diabetes medication, and cholesterol lowering medication, also we need lifestyle changes. 100%. So actually, doctors are now even writing a prescription for exercise. Just like you think about, well, I got to take my medication in the morning. There really should be a commitment to, you're going to have to really work at combining the 3-headed monster, which is diabetes, high blood pressure, high cholesterol. And then wrap it up in prayer, wrap it up in, okay, help me not have this chocolate today. Help me make these lifestyle changes. One, how do you eat an elephant? You all to see my slides. I say this all the time. How do you eat an elephant? 1 bite at a time. Laverne says, is there a correlation between metformin and dementia? I need to look that up. I do not think so, but I need to look that up, and I'll look that up. Key point is also on the dementia, which I talked about earlier. Poor sleep in your 30s and 40s and 50s leads to an increased risk for dementia. High blood pressure, increased risk for dementia. Diabetes, increased risk for dementia. And now I'll just do this in 1 second to talk about dementia, because we have now in this country done a great job of saying dementia and Alzheimer's, they are not the same thing. My last name, my maiden name is Allison, right? There are a lot of Allisons, So if I'm an Allison, well, Thomas and Jerry Allison got 5 kids. Each one of us now are different people, right? So what happens is dementia is the big family. Alzheimer's is a branch of dementia. It's a type of dementia. It's Alzheimer's dementia, right? Just because you have memory loss does not mean that it's dementia. If you have poor sleep, you can have memory loss, okay? So there is Lewy body dementia, and that's when people start acting out crazy. And it's just a different type of dementia. There are different types of dementia. If you have high blood pressure, you have many strokes, and no, you don't get paralyzed on one side, but you have multiple strokes that knock out the brain center. No, you don't have Alzheimer's, but you do have vascular, which is the blood vessels, dementia. Okay? Way to go, Terry. Down 15 pounds. 1 pound equals 4 pounds of pressure on the knees. That's exactly right. So if you lose even a pound and you have arthritis on the hip or knees, you are decreasing your pain and your arthritic issues on the joints. I love all the comments. Okay, so I talked about dementia. I'm going to do a whole Facebook Live on dementia and how to navigate dementia, because there are things to do. Early dementia. Sarah Day O'Connor this week came out and said that she has now Alzheimer's disease. And then there are other things. Please, 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 for our elderly persons, and I have my mother doing, has a prescription. I need her doing crosswords puzzles every day. And she now has become obsessed with crossword puzzles. Keeping the brain active actually helps offset, and most of you know I'm a trained internist, so adult medicine, but I also did 2 extra years in training of geriatric medicine. So glad about the dementia piece. Whew. Okay, I love to talk off the cuff. I ain't have nothing prepared except for this cold and flu little chart that I'm going to put up here. But do get your flu shot. You need a pneuma vaccine. You also need the tetanus vaccine. And then this is the final thing. This week has been very traumatic. I don't know about y'all, but it's been very traumatic. Yes, I've been tired. Yes, I've had a cold. Yes, I've had some personal issues, whatever. All of us have issues, professional stuff, whatever. But we've also watched people die on TV. We've watched people yesterday, a gunman go into a synagogue and shoot up people. We watched people go to the grocery store and be killed. We watched pipe bombs be killed. This country is in a tremendous place of disruption. Tremendous. I don't know about you, but I'm feeling the racial tension. I'm feeling the sexual tension. I'm feeling it. And it's depressing. And then we're becoming numb. One of my friends said this week, I'm becoming numb to it. I just don't even watch it. I'm becoming numb. I'm numb to what the president said. I'm numb to what the Democrats and Republicans say. Let me tell you, don't be numb enough not to vote. All right, I don't want to hear nobody talking about how crazy anybody is, how bad this nation is, and you don't vote. Number one. So please make sure you vote. And guess what? I don't care how you vote. Exercise your right to vote. I have my own political leanings, but you exercise your right. Terry, no, this is not every Sunday, but I do try to publicize, and I do try to do a Facebook Live at least once every 10 days, but not every Sunday. Maybe I need to be more regimented. But I have to say this. Please take some time tonight to actually turn off the TV. You have to disconnect. You cannot see shootings, pipe bombs, people arguing with each other, foolishness over and over again, and it not affect you. So just take some time. We need to go back to reading a book. We need to go back to listening to music. We need to go back to just being quiet. Last night, yesterday, if you see my post, I shut myself in my TV room and I watched a wonderful movie. Pastor Kevin White, hi. I was talking earlier, there's a Faith Leaders Luncheon tomorrow. Please inbox me. We're going to have some potential funders there for some church initiatives. But But I locked myself in a room and just watched a old movie for 90 minutes. And it was one of the best things I had done all week. I didn't really have time to do that, but I didn't have time not to do it. So do take time for yourself, take time for your health. Thank you for all the engagement on today. Definitely, Pastor Kevin, please inbox me. Please take time and do step away. You cannot watch all of we have been in a reality TV show for the last 2 years with craziness over and over again, but now it's gotten deep. You see the caravan. You see the kids that are still like that. You see all of this carnage. You see all of the hate. You listen to the pundits back and forth. Somebody sending pipe bombs. All of this, and now you have your own stuff you dealing with. Your husband, wife, companion may be cuckoo and getting on your nerves. Your kids may be getting on your nerves. Your parents, your sibling, whoever, work getting on your nerves. You need to sit down, take a deep breath. And yes, if you're a person of faith, prayer, meditation, sit there. Again, if you drink a glass of wine, that's on you. But make sure that you ain't drinking 10 glasses of wine. Right? Because then you have another issue. And something else is not going to help you. You need to go inside and say, okay, let me just calm it all down. And know that in the end, you always win. All right? Hi, Laverne. I do miss seeing you. You're in Texas. I know. I miss seeing your beautiful self. Watch A Question of Faith on Netflix. I'm going to have to watch that. Okay, my people, I said this was going to be short, but thank you for all of your comments. This will be posted. Please repost. And I am going to put on the chart about, is it a cold or a flu? That's something for you to print and have, and you'll know, is it cold or flu? If in 24 hours of getting the flu, you contact your physician, you can get something to decrease the amount of time that you will have the flu. And if you do get the flu in particular, do not go to work and pass it on to everybody else. The flu is deadly. Let me be clear. The flu is deadly, especially for our old and our very young, and everyone, actually from infants to the grave, unless you have a reason why you cannot take the flu vaccine, it is recommended that you get it. Okay, you all have a wonderful Sunday. Thank you for joining me. It finally cooled down in my house, and I put a post up today that chocolate and friends are so good, but the best thing is a friend with chocolate. I thought a friend would drop some chocolate off at my house, but they didn't. What? Nobody took the hint? All right. I hope this helped. Did y'all learn something? I hope so, and I try to keep it very real. Thank you so much. Appreciate all of y'all. And please repost this on your sites because you never know who needs information. Thank you for coming into my house. I'm going to go now work out. Yay! Bye-bye.